This is a great time to talk about food allergies. The rise in food allergies are multifactorial and have a lot to do with our current lifestyles, including our dietary practices and living environments. One prominent theory, called the dual allergen exposure hypothesis, proposes that when infants are exposed to food proteins via a broken skin barrier, as occurs in eczema, the body can respond by mounting an inappropriate immune response that leads to allergy. However, if an infant is first exposed to a food through their gut by eating the food, this will lead them to establishing an appropriate immune response and not developing allergy to that food. Investigators tested this theory in a landmark Learning Early About Peanut Allergy study, which is otherwise known as the LEAP study. In this randomized controlled trial, high-risk infants with severe eczema or egg allergy either received peanut products early in life between the ages of 4 and 11 months or did not receive any peanut products. The group that was exposed to peanut products decreased their development of peanut allergy by 80%. The number was so striking that new guidelines were developed in the United States to encourage peanut product introduction. These guidelines are called the Addendum Guidelines for Peanut Allergy Prevention in the United States and were developed by an expert panel at the National Institute of Allergy and Infectious Diseases and supported by the American Academy of Pediatrics. This report includes recommendations for high-risk infants with eczema, as well as low-risk infants without eczema. The guidelines encourage pediatricians to assess infants around the 4-month child care visit. We will now discuss each of the 3 recommendations in detail. Guideline 1 is for high-risk infants who have severe eczema or a history of already developed egg allergy. For these infants, pediatric clinicians should order a specific IgE to peanut and/or refer to an allergist. If the IgE, often called RAST, is greater than 0.35, this is considered positive, and the infant should immediately be referred to an allergist to determine if further testing or an oral food challenge is needed. If this value is negative or less than 0.35, the family should be encouraged to start peanut products at home right away.
Now that we have a good plan of care for treating the eczema, we should talk about food allergies. Your baby's severe eczema puts him at a high risk for developing food allergies. The good news is, there's something we can do to prevent peanut allergy, which is the most common allergy amongst children.
Prevent peanut allergies? How?
Well, it's as simple as just feeding your baby peanut-containing foods early and often. You want your infant's immune system to recognize peanut as a food that's safe. By feeding your baby peanut-containing foods early in life and keeping it in your baby's diet, this can prevent your baby from developing a peanut allergy.
Really? How do I do this?
Since your daughter's eczema is severe, I'd like to order a blood test called a peanut IgE, and if that's high, I'll refer you to an allergy specialist. However, if the tests are negative, you can introduce peanut products now. There are many options for how to do this, including peanut powders, peanut butter thinned out with water, or applesauce. You'll want to do this several times a week, and I'll give you an instruction sheet to explain how.
Does this only work for peanuts or for other foods too?
That's a great question. Currently, we have strong evidence on prevention of peanut allergy. The American Academy of Pediatrics has stated that no foods should be delayed. And in general, research supports introducing lots of different foods in your child's diet, one at a time.
Wow, that's really helpful. I didn't know any of this until today.
Guideline 2 is for infants with mild or moderate eczema. These infants do not need any testing and can be fed peanut-containing foods starting around 6 months.
It sounds like daily bathing and barrier creams are keeping the eczema under control. Now that she's 4 months old, we should also talk about early peanut product introduction. Your baby's eczema is mild, so she can start peanut products in her diet soon after starting other solids. I have a handout that will explain how to do this. Recent research studies show that by doing this, you can actually prevent peanut allergy, which is the most common allergy among children.
Guideline 3 is for infants with no eczema. Although eczema is a major risk factor for food allergy development, some children without eczema can still develop food allergies. For these infants, the NIAID guidelines do not stress a specific time for peanut introduction. However, please remind your families not to delay introducing peanut products. They can start introducing peanut-containing foods starting around 6 months after the introduction of other foods.
How exciting that little Johnny is ready for solids. Do you have any other questions regarding solid foods?
No, I don't have any other questions right now. I think he looks ready to try.
There is one other thing we should discuss. Have you heard about early peanut product introduction?
I actually read something about it online, but what exactly is it?
Recent studies have shown that when infants eat peanut-containing foods like peanut powder, peanut butter, or peanut puffs, they are less likely to develop a peanut allergy.
Oh yes, the article I read mentioned this. What age do we start Johnny?
First, you'll want Johnny to try a few other solid foods. Let him have some practice getting used to using a spoon and showing you that he can swallow well. But once he's done that, you can add thin peanut butter or powder and see how it goes. The key is, you don't want to delay him having peanut in his diet. You can start around 6 months.
Thank you again for your time. Remember, together we can reduce the development of peanut allergy.